Welcome to the podcast. It is me, your host, Dr. Debra Durst, and my co-host.
Hey guys, Faraday Golombiewski, nurse practitioner here at RevitalyzeMD.
So today we are going to clarify a topic that we get asked every time we bring it up because we just assume everyone knows what it is, but clearly they don't. And so we were just going to clarify it in a quick podcast, and it is a troche and some facts maybe about compounding pharmacies while we're at it too.
So what is a troche? If you do not know, a troche is a medication that is compounded that is put underneath the tongue to help rapid absorption of a medicine. That's it. In a very simplified
We're done.
version.
We're
done. That's a troche.
Done. End of podcast. That's it. And it is spelled Troche. So we've heard troche and but it's troche is how you pronounce it, and Troche if you're listening and don't happen to be on YouTube when we list it below.
Yeah. So this isn't something that we sell. This is something that you get from a compounded pharmacy because it is a prescription medication.
And I think how we get asked this probably more commonly because we're huge fans of it. And one of the products that we're a huge fan of is a troche and a combination of a low dose Cialis and Viagra. And so we have talked about
fantastic.
They love it. So if they're on regular dose, either Cialis or Viagra, and so Viagra being shorter acting, Cialis being longer acting, they can get some side effects, that might be nasal congestion,
headaches, flushing.
Yeah. So they don't always like that. And so actually, if you took Sudafed, which some of them do, because the nasal congestion can be bad, it actually reverses the effects of it.
Exactly.
And so another thing you don't want to do. And then we use this as a combination troche with our patients, and so introduce them to another form of both Cialis and Viagra. We've talked about it on previous podcasts. So I think that's where the question has come up multiple times and how to get it. And so it's from a compounding pharmacy. You may be able to get a low dose of Cialis and a low dose of Viagra, and maybe not in combination from all pharmacies. We do have a local one that does it, and now the main compounding pharmacy that we use also does it per request.
But most compounding pharmacies can do just tadalafil, just Viagra as individual troches, but you can always ask the pharmacist if they do a combination.
So, and again, we're always using brand names. So a couple things we'll just clarify. So a lot of medications have a brand name and then they have a generic. So Viagra being sildenafil and Cialis being tadalafil. And so what we're talking about is a compounded versus a commercial preparation of it. And so commercial or manufactured, you're going to get at a regular pharmacy, and it's per a drug company and can't be customized as much as a compounding pharmacy.
It comes in predetermined doses and prescribed by those doses, and you just pick up from the pharmacy like your Walgreens or CVS's.
Correct. And if they're different companies, you're never going to get a combination of those products. And if they have a patent on them, it's, a certain amount of time. And I think 7 years is the patent. And then after that, you can do a generic form. So then you have other companies making the generic form. Just going into a little bit of pharmacy related stuff, since pharmacy is my background.
One of many.
One of many. Do tell. Do tell. So, but basically, we love compounding pharmacies because they are going to customize products for you. Yes. And so now we can customize for the patient. But there's still, again, FDA regulations of compounding pharmacies. So there's a perception that, FDA compounding pharmacies are not regulated. And that is not true.
That is not true at all.
There are FDA regulations. And again, FDA has recognized the importance of compounding pharmacies to make medicines that are more customized for a patient, more individualized. But they do have regulations that they have to meet with sourcing and quality.
And I would say that compounding pharmacists would beg to differ and say they have even more regulations on them.
Well, I would agree. I think across the board, it seems to be that way anyhow, which, again, is fair because we want to make sure it's safe. And that's the FDA's goal, is to make sure it's safe and effective. And so I think as long as that is there to protect the public, I think you just need to know that they still are regulated and they are safe and they are effective. And so now we can customize it for our patients.
So with the troche, it can
Back to
be
the troche.
many different flavors.
The topic of the podcast.
The topic of the podcast. So it can come in many different flavors. The ones that we use for our sexual wellness are in peppermint, but you can get them, I heard, in banana or any other flavor that you can request. They try to pair a flavor with the medication to try to mask the taste of the powder or the medication. So if the pharmacist recommends a flavor, I would just go with their recommendation. But it is a small dissolvable. It goes sublingual, so underneath the tongue, so that it will dissolve and then absorb into the bloodstream a little bit quicker.
And mainly they're made in squares. And so it is, and again, we don't know the details of, the like the ingredients that are in with the medication to make that more of like a square and solid. In my opinion, it, depends on probably the medication or the pharmacy, but I feel like all the troches that I've ever seen or used are a little harder to dissolve. So I am not a huge fan myself unless they dissolve quickly, and the ones that we use typically do.
You got to heat your mouth up.
You do. You got to heat, and that's why we take our temperature underneath our tongue. It's hot under there, and so it does dissolve, but it might take a little bit longer because you can use progesterone that way. So you can use different medications that way. Bypasses the liver, goes right into the system, so it doesn't have to go to the liver to metabolize, and it, like Verde said, faster absorption, faster acting, and potentially could again bypass that GI tract, so that empty stomach may not necessarily be as huge a factor with Cialis and Viagra, although I still do recommend it because some of them are going to get oral absorption because it doesn't all dissolve.
And let's face it, people do not wait for it to absorb. We had someone in this office, not saying names, that said, well, can I just chew it?
Yes.
So if you chew it, you can, but you should have just taken an oral.
Well, I'll just say, like, if you chew it, it just won't be as effective. How's that? Then maybe they won't chew it. Just be simple with it, right? And we won't say anything more than that.
There you go.
But troche underneath the tongue, and it dissolves, goes right into the GI tract or right into the system, bypasses GI tract, takes effect faster, and you can do all kinds of different medicines, but it's done through a compounding pharmacy.
Absolutely.
And that was the longest version we could possibly do on a troche, but we did get lots of questions on it, and so we just thought we'd cover compounding pharmacies at the same time.
And if you want to learn more about Cialis and Viagra compounded troche, you can look back in our podcasts, and we did a whole podcast or two on that with a compounding pharmacist. It's a great listen or watch if you're on YouTube.
That we will put the link in the description to that previous podcast. And again, that is something that we frequently get requests from remote patients because they can't find it locally. So if there's anything else that you have questions about that we can answer, or anything you would love us to do a podcast on, please leave it in the comments, and like and subscribe.
Because nothing is off the table.
Nothing's off the table. And if you haven't seen our Guinness Book of World Records, you would know nothing's off the table.
Nothing's
that was
off
a
the
fun
table.
one. So, but anyhow, let us know, like, subscribe, share, and we're willing to deep dive into anything sexual wellness or wellness.